Assalamualaikum warahmatullahi wabarakatuh. Good afternoon everybody. Let me introduce myself. My name is Artika Nurrahima. You can call me Artika. Today this session I will share about dealing with obstacles in conducting nursing practices in hospital and public health centers. Trigger question: how do you do clinical practice happily? Material overview. This course focuses on comprehensive physical, mental, and social preparation of students and helps students to adapt to clinical practice courses in hospital and also public health center environment. This course teaches participants the ability to solve the problem when facing the obstacles in conducting nursing practices in hospital and public health centers. How about the obstacles in conducting nursing practices in hospital and public health centers? They are: first one, lack of protective equipment. The second one, lack of supportive work environment. Third one, conflict of human consideration and bureaucratic structure. Fifth, failure to meet basic needs. Sixth, the personal and interpersonal aspect of caring. 7. Safety. And the 8. Psychological problems. For the obstacle that the student face in the clinical areas, then strategies in overcoming obstacles in conducting nursing practices in hospital and health centers are: as a healthcare professional, they have to great self-regulation. How can we do or we have great self-regulation? By combining 3 points. First one is attention control, second one is self-awareness, and third one is emotion regulation. For the self-awareness, we have to pay attention to the stress response, craving, self-efficacy, and sense, and then self-kindness and self-compassion, and then social support. For the emotion regulation, we have to pay attention to self-referential processing, values clarification, awareness of present experience. In mindfulness, we have to combine 3 points: clarity, compassion, and then connection. Mindful clarity associated with spiritual awareness, related organs, when in balance, when overdeveloped, and when weak. How can we build a mindful clarity? By performing religious spiritual activities. This performing religious spiritual activities to achieve peace and quiet in times of calamity and other unexpected and terrifying situations. Some nurses claimed that they relied on religious and spiritual activities. In fact, spiritualizing their work. Some nurses attempt to spiritualize their profession by viewing it as jihad in the cause of God. Mujahideen for the love of God, believing that if they were infected with virus of illness and died as a result, they would go to paradise since they were killed in God's name. Trying to convince the family and gaining their support. Get the family support in order to obtain assistance from them as a powerful emotional resource. They took steps like explaining the value of nurses' jobs, respecting health rules and calming the family, displaying working conditions to family members, and making phone and video calls to the family show them what it was like to be a nurse. Enhancing their sense of self-worth and responsibility. People's and the media's attention and support for medical professionals, particularly nurses, in cyberspace made nurses happy and contented, strengthening their sense of self-worth and duty. Compassion. Self-compassion, being warm toward oneself when encountering pain or personal shortcomings. The benefits of self-compassion are increases motivation, boosts happiness, enhances self-worth, fosters resilience, reduces anxiety, depression, and stress. How to compassion? Acknowledge your self-talk compassion. And this is the reference of our discussion today. You can read more from the reference. That's all. Thank you for me. Hopefully it will be a benefit for you. Thank you. Wassalamualaikum warahmatullahi wabarakatuh. Good afternoon.